What type of disc conditions exist that impact people's health and pain, and obviously then therefore their quality of life as well? There are quite a broad number of disc conditions, and most people often think when they think of a disc, they think of a slip disc or things like that, and that's actually a mythology. The disc conditions that do exist and the problems that do occur primarily start with a disc herniation, a compression and inflammation of the disc, a prolapse of the disc where you see extension of that injury and the actual disc material starting to bulge out of the circumference of the disc area. You also have what's called a sequestrated disc where there's actual damage to that material, and we actually start to see the outer boundaries of that disc being encroached by the inner disc material, and there's like a squashy part in the middle and the fibers on the outside, and so there's an extension of that material, the inside into the outside area of the disc, and that's obviously a big problem. And then there's a degenerative disc process as well, where it starts to break down, lose its hydration, and starts to shrink and narrow, creating a whole range of other and host of other problems. What is degenerative disc disease? A wrong classification. It is not a disease. It's a commonly held diagnostic term, degenerative disc disease, DDD. What it actually is a degenerative disc condition more than anything else, where we see that the fibers break down of the disc, the outer disc material, and we lose some fluid of that material, and it starts to compress down, and so the disc degenerates, it loses space, and it's usually associated with, or can be associated with, degenerative arthritic conditions as well. And really what you think about, you may never have done this, but I certainly have. If you leave a shirt out on the line over summer for a couple of weeks and you grab that shirt, and instead of it like bouncing back, it just goes, that's what's happening to the fibers in disc degeneration. They're losing their elasticity, their ability to spring and bounce, and that creates a whole host of problems associated with the degeneration. What is a slip disc? That is a mythology. Most people, when they talk about a disc injury, they say, oh look, I slipped my disc or I put my back out. That's not actually what happens at all. That's not an accurate description of what's taking place within the back, the spine, or even the disc material. A slip disc is a layperson's term to describe one of the many factors associated with the disc, either a disc herniation, a disc protrusion, a disc sequestration, or even a degenerative disc condition where there is breakdown in disc, decrease in function of that disc. So it's, when you put your back out or you slip that disc, you're really just saying something is wrong in the region of my back. I have pain, I have discomfort, I might have sciatica associated with that, and recognizing and knowing and understanding that the disc is part of the problem, or the pain in the back is uncomfortable, limiting my function. What we're really then doing is wanting to recognize and understand. We need to go further in our examination process and uncover the true nature of that disc condition, and not target as a layperson might in just saying something's wrong with my back. We will need to know what's wrong, why it's operating and functioning in that way, and what's caused it, so we can put together the most appropriate and effective program to resolve that disc injury itself.